Okay, hello, I'm Dr. Rajveer Chinoy and I'd like to talk a little bit about wrist pain. A lot of people these days come to the doctor with wrist pain due to various causes. Remember, this can be caused by a strain of heavy work, a problem due to repetitive stress, or there could be a history of a fall and there could be a minor fracture. It's always important to get an accurate history and proper examination so that we are able to make a good diagnosis and give them the proper treatment. Most important, find out whether the person is doing something repetitive, if their job or work is strenuous with heavy labor, is it their dominant or non-dominant hand, and has there been a history of a fall. It's also important to exactly locate the position of the pain in and around the wrist, and it's important to rule out osteoarthritis and rheumatoid arthritis as causes for the wrist pain. And another common thing, especially in women of middle age, is something called carpal tunnel syndrome. There could also be causes like painful ganglion cysts, bony diseases like Kienbock's disease, or there could be bursitis or tendinitis. Obviously, a careful wrist examination has to be carried out. You have to look at the wrist on all sides, look for swellings, check the tendon movements, check the wrist movements, and ask about a history of a fall recently or in the past and any previous treatment taken. X-rays are the first investigation which should be done, and you should look at the metacarpals, all the 8 carpal bones, and the distal end of the radius and the ulna. This can show up problems like calcification in the tendons, fractures of the scaphoid, Kienbock's disease of the lunate, fractures of the distal ulna, or small fractures of the styloid process of the ulna. The next investigation would be CT scan and MRI. And if there is a problem of a carpal tunnel syndrome, then you would have to do nerve conduction studies to prove this. Diagnostic and therapeutic arthroscopy of the wrist is also a new upcoming modality which is used. Now, to prevent wrist problems, you should do general exercises and keep your hands and wrist strong. You should be taking adequate calcium supplements and vitamin D, having regular amounts of protein in your diet, especially when you are middle-aged or older. Be careful to avoid falls. Be careful to avoid repetitive strains like using the thumb very often or doing very strenuous exercises. And it's always useful to wear protective wristbands or splints when you are playing strenuous games. For acute sprains and injuries, non-steroidal inflammatory analgesics and ice packs help in acute sprains and injuries. Use splints to rest the wrist in case of sprains or undisplaced fractures. Plasters may be required for displaced fractures. Physiotherapy is always useful in repetitive stress, sprains, and surgery may be required in case of fractures or for carpal tunnel syndrome release. Thank you.